we learned that if people call into the meeting, they're not able to join a breakout room. We learned that. So we had several individuals who came in, and then Jamala actually had to see a patient, so she put herself on hold. And so that's why she was not getting into a breakout room. So um, that was the issue. What I think I'll do now is that we're going to pop up. Everyone sees the breakout room Jamboard. So did everyone select an individual to report out for each of their breakout rooms?
Yep.
All right. So why don't we go with breakout room 1?
All right. And just as a preface, we only got through the first two questions, so our action items are a little limited. But kind of speaking on what we can do as members to effectively promote and implement strategies in the asthma strategic framework is a big part of information dissemination amongst our respective avenues. So in our group, I work with the Minnesota Amateur Sports Commission. We work with all the youth sports governing bodies, which we also work with high school, but the youth sports world is really fragmented. And it all depends on sport. Some are really organized, like hockey, where they have districts and ways to kind of flow information down from the top. And there's some like baseball, where it's just little fragmented groups all over the state, and there's some governing bodies. But way we can work with them, the Minnesota Amateur Sports Commission website's a place we can post things. We currently post education. A big thing is how we educate these governing sports bodies, and ideally get someday, and we'll get that in the second question, of how we require and what are current requirements in those worlds, similar things that we could do. Also in the school nurse world, using listservs, using their website as a resource, and then also being a place for referrals from our respective organizations. With VU in Minneapolis, their home-based asthma program, local health providers, when you release someone from an emergency visit, how they get referred to the Minnesota Asthma Program, and treat in that way. So kind of our different respective organizations, a lot of education, referrals, and information dissemination. And then, and yeah, anything before I go to the second slide?
Nope. I think you can move on to question 2. Susan and Bilkis, are you ready to move on to question 2 for this group?
Yep, Jamie's got it.
All right.
Perfect. Kind of the barriers, just speaking, in my world, and there's a few reasons in sport. I mean, one, as I spoke about the desperate organizations, there's no real true governing body amongst all sports. The Amateur Sports Commission, we are a small body with not a lot of regulatory ability. We may be getting more, but something we see in sports that I personally experienced, and you see, as we heard as other anecdotes in our breakout group, this culture of toughness that's often misguided and misunderstood, of trying to get a kid back onto the playing surface, whether they're currently having an asthma experience, or they're having some trigger events. A lot of that's a cultural thing, and a lot of it though really comes down to lack of education. So again, how do you implement this in these sports groups? Require them to do so. As I said earlier, there's something called a safe sport, that is about how to be a mandatory reporter, physical, psychological, sexual abuse. That is a requirement by a lot of sport bodies, for all parents and coaches and volunteers to take. If we could piggyback on kind of that requirement, especially with some education to these governing bodies, let them know that in all likelihood there's an athlete on every single team that is an asthmatic. So having that education is very important for all coaches and staff, and it'd be great to even get to the parental level. Now, as we see in, as Vu brought up, and we experience it here, there's staffing. There's only so much ability, and then only so much a champion can do. How do you take this, this champion attitude toward this, and make it a requirement, and then continue with that follow through? That's something we didn't completely explore, but it's very important that, not only do we bring this to the attention of the bodies we work with, but how do we see through this requirement or action? A lot, of course, a lot easier said than done. I think we, you know, may try and fail, but I think we can get there by continuously pushing it. And then there's some general mistrust, whether it's amongst certain communities or certain groups of people of public health, how to bridge that. And, you know, I think asthma is pretty straightforward, and, you know, experiences are pervasive across, you know, political parties, races, ages, athletes, non-athletes. It's something we may be able to take advantage of here, but something that was definitely brought up as a barrier. And then you know, some other, let's say, public health fatigue in our worlds from COVID-19. You know, that's just a general maybe malaise across our communities, but a barrier that we recognized.
Jamie, I just have a quick
Yeah.
question.
Yeah.
Safe Sport and the CDC concussion online learning modules, those are required, right? And I know that you have them on your website along with
Yep.
the online athletes and asthma coaches course. So that
Yeah.
those are required, but asthma is not. It's one of those
Mhm.
things that, you know, it's a voluntary. We're encouraging coaches to do that. So I think, as you know, and we spoke of this before, that's one of the challenges. So did
Totally.
you guys have anything else to add on question 3 here? Just, I know you didn't get to it, but just kind of off the top of your head, do you have anything to add here from the group?
Yeah, I mean, some of it, I guess, some based on some of our ideas and that information dissemination. Obviously, you know, us getting the framework up, you know, with the school nurses actually reaching out, putting it on their website, utilizing their listserv, their email lists. What I could commit to, we somewhat regularly bring together all youth sports governing organizations, so I could provide a presentation to our group and the importance of bringing it. Into their, let's say, requirements or recommendations. You know, there's a few ways to do this. It could either be, you know, a ground up kind of thing where you find a few adaptable progressive organizations that would be willing to require it at the organizational level or association level. Or, you know, maybe there's a sport that we could actually get at the state governing body level. Like it might be a varied approach depending on how big of a ship they're steering. And sometimes finding a champion association like a, you know, like let's say Minneapolis United soccer, just their club, you know, that would be a great in. Or, you know, let's say we get the US swimming chapter in Minnesota to requirement. You know, I don't think it would be everyone would do the same thing, but finding a few sub champions would be a great accomplishment, at least in the sport world.
Great. Well, it sounds like you guys had a really good conversation. So I think we're going to move on to group 2, and that would be Anne and Connor. And do you guys have a designated report out person?
Yes, Gail volunteered.
All right, Gail, take it away.
So, yeah, so I mean, there's a lot of overlapping themes, obviously. And we actually weren't talking so much as people were just sort of putting stuff, their ideas in the sticky notes. So, you know, from as far as promote and implement strategies, you know, I had talked earlier about having the Boy Scouts and the Y require their staff or approach them about requiring their staff to do the asthma and athletes program. Again, providing professional development to school nurses. And again, the engage other organizations, pretty much what Jamie was talking about asthma in sports. There was another thought that I had was to work to try to get this out to the health plans. You know, I've had very successful discussions with the health plans, at least the Medicaid, the people who are in charge of the Medicaid programs, about paying for kids to go to Camp Super Kids. You know, if these health plans, if this was promoted to the health plans, they have a vested interest in keeping their members out of the emergency department, regardless of where they are. You know, that's going to save them money. So I think trying to approach the health plans, there was some discussion about again, there was schools, let's see. Oh, I actually think that there might be a way to, and again, utilizing SQUIRMS or Minnesota Community Measurement. I mean, to me, if somebody's required to report something, then the clinic should have information about what it is, like colon cancer or breast cancer. You know, maybe Minnesota Community Measures can send out this asthma strategic plan with all of its resources to the clinics who are reporting. Let's see.
It looks like you have a lot of really great ideas here. Some of them are very, similar, but
Right.
really
So
great
there's a lot of
ideas.
overlap. So why don't we go to the next one?
Yep. Question 2, we want to make sure group 3 has time to
Right,
report.
right. And then we talked a fair amount about capacity, lack of power, lack of training, as far as barriers, lack of staffing.
Mm.
Obviously there's a lot of challenges with that. Reimbursement limitations, again, that's lack of money. So that was that was sort of the challenges. And then basically I will, as I said, forward the information to the Boy Scouts and the Y. And I can start to bring up the conversation and share this information. This will be after camp is over. With the Medicaid managers, I have a relationship with Blue Cross, UCare, and Prime West.
Excellent.
And so we can maybe start that. We're talking about bringing asthma education to Minneapolis. Housing inspectors, I don't know, that wasn't me. Somebody else is doing yellow as well. So I'm not sure who
This
said
one.
they were gonna do that kind of stuff.
Okay. All right. Well, thank you very much. Great reporting, Gail. And I want to make sure that group 3, that's Kathy's group and Emily's group. And you guys have your designated person to report out? Kathy and Emily?
Was going to.
Okay. Here she is.
Yeah. Yep, I can start. And if somebody wants to jump in, feel free. So a lot of overlap again. So we discussed on the first how to promote and implement the strategies. So sharing the framework with our with the clinics, with Children's in Minnesota, some of the programs, promoting it through some of our collaborative grants with internally at MDH, and then sharing it with the Health Equity Bureau, and let's see, and then and continue to provide the asthma home-based services, utilizing this framework, and also in the healthy environments programs. So I think that's kind of, did I cover everything? Oh, in the occupational arena as well, occupational asthma. So discussing this.
And I'll move you to question 2, Kathy.
So some of the blocks and solutions. The challenges that we saw were similar: lack of resources, time, constraints on staff, prioritizing. So when there's, priorities are more food, resources, what's going on in the home, other stressors in the home, that this may not be the first thing that's identified. And then solutions. So more highlighting this, working collaboratively, and then also looking at some, showing some of the evidence where some of these actions have been useful, maybe in other states or other areas. So highlighting the importance of the action, the strategic framework, and then braiding some of the resources.
Excellent. I love how you guys did your groupings. That was really great. Okay, third question. What steps and actions will you commit to in order to implement the asthma strategic framework?
So I think we also that we would share with some of our partners internally and also, some of the providers, the clinics, and, at the clinic end for resources and tools, but also at the prevention end, looking at groups such as Clean Air Minnesota. So looking at the effects of the environment and how that impacts asthma. So sharing, we all dedicated or committed to sharing the framework.
Okay, very good. Does anyone have any other things to add here or general comments about the breakout rooms? I'm going to just take us back to our slide deck. Anne, is that where you would like to go, or would you like to talk a little bit more about this breakout room activity with everyone?
So I'd like to just throw out there that there's a Minnesota Academy of allergists. There's actually a pretty active group of allergists that I think should be included in, and I don't know if there would be somebody who would be interested in being on this committee, but also that would be a good place to try to send out the strategic plan, because, I think that definitely primary care clinics are important, but these allergists get a lot of asthma referrals, both for children and adults. So I think that is to me like an untapped area. And I think we should try to reach out to, and I don't know who is, there might be a person, oh crap.
Gail, I recall that ALA had like a listserv that went out to those groups, but I don't know if they still retain that now that the association has changed a little bit from a national.
So I would talk to Jill or Lisa about that. The other thing is I know that Nancy Ott is an allergist with the Asthma and Allergy Associates, and Rick Bransford also. And I think Nancy's been very active in the Allergy Society.
I know Nancy, yeah.
Yeah, so I would reach out to Nancy, and then Dory's posting, connect with the American Academy of Pediatrics, and actually there's probably either an allergy section of the American Academy of Pediatrics Minnesota chapter. So that would actually be something to look at, but that's a great idea, Dory.
All right, thank you so much. Those are good suggestions. So I'm going to turn it back to you, Anne. We're at 10:42. And for wrap up and next steps, or any other comments that you would like to make on the breakout room activity?
Okay, well, thank you everybody for participating in the breakout room and hanging in there with us. I know that 2-hour meetings are long and a big ask for people. So we are going to take what we've gotten from you from the breakout rooms, both from the Post-its and the discussion, and we'll prepare a summary and we'll share it with the AAC members. We will then use that document to help us promote and implement strategies, to engage stakeholders, and to also review solutions to challenges and action steps. And we'll probably be asking you about some of these steps as we move through the rest of our meetings this year. We will also ask you to help us identify methods to evaluate our efforts around implementing the asthma strategic framework. We put a lot of work into the framework as a team, as a committee, and calling upon stakeholders throughout the state to provide feedback. So we'd really like to know, how it's doing. So we will be evaluating this. We'll be doing a process evaluation first, and then we're going to start an outcomes evaluation probably in about a year just to see how this is working. And as I said, we'll be checking in annually, I mean, at each meeting to see what kind of progress people have made and kind of taking a step and trying to move that step forward. So again, thank you all for your participation. If anybody has any remaining comments or questions, fire away now. Otherwise, we will adjourn and we'll see you next month. Well, actually in June.
Yep, June, the next meeting is June 23rd, from 1 to 3. So I'm gonna,
And
does anyone,
also, if anybody has any comments or suggestions about how this Jamboard worked, we'd like to hear, because we think it's a pretty effective way of getting a lot of voices out there.
I have a question. There's a question from Dory, sort of a question that Anne, you might be able to answer a little bit better, or I'll let you do it. It says, how can we make sure that providers are aware of legislative changes for enhanced asthma care? And enhanced asthma care came up in group number 3. We talked a bit about it.
And group number 2, we've been working with DHS around this. We're not really sure how to get the word out there. We have our asthma listserv, and we've sent some things out through Gov Delivery. But you know, any given month, we can't guarantee that somebody's going to read that. So if you all have any suggestions as to how to spread the information more effectively to people that need to hear it, we'd really appreciate it. We know that clinics are going to be absolutely essential to making this enhanced asthma care bill work for us and for people with asthma. But we actually don't have a listserv of all the providers in Minnesota. We only have those who've signed up with us. We're also using Basecamp, but again, not everybody belongs to Basecamp. We've talked to DHS, but DHS usually just relies on their provider manual, and they've got some links out there. So maybe I could include those in a note that we could forward to AAC members. But we're really struggling with this particular bill because it involves local public health, healthcare providers, schools, and then these people with environmental credentials that we don't usually have a lot of interaction with. So it really is a big ask, and we are trying to work toward something. We have to really wait for leadership from DHS to know, you know, the bill, the coding they'll allow to be used, the reimbursement rates, and if they can provide any sort of feedback on how people that are not used to working within the DHS system can provide these services and get billed for it. So I don't think that really answers your question, but we are kind of trying to address this situation right now.
and if I can just add too, Anne, I think, you know, we're just still waiting to hear, you know, back from DHS too of you know, their information that we can share to link to resources on their website as they kind of work through this and figure it out as well. So we're kind of working and collaborating with them on both sides here. I would, before I let everyone go, if it's all right with you, Anne, I would like just some general feedback on the breakout sessions. Did people like these? Is this something that people would routinely like to do? I know that we ran into a few technical glitches, and some of those kind of ran into issues with people calling in on their phone lines or not having the Teams app, you know, on. So I did my best. So my apologies if it wasn't perfection, but it was a bit challenging to get everybody placed. Some people dropped off and came back on. So just some quick comments from anyone.
I like the breakout rooms because it helps to substitute for the in-person, the small meetings you used to be able to have.
Mm-hmm.
You know, at tables or when you have the yeah, I like them and I think they're useful. And I liked the being able to put things up on a sticky board. I also thought that was useful.
Excellent.
This is Dory. I liked it too, even though there was, you know, a few technical glitches, like you said, but I do think it's a good idea.
I think it'll get a lot easier next time if we do it again, which I think we will.
Yeah.
Great. Thanks for the feedback. I had a plan. I had everybody in their buckets and I moved everything in there, and then some people didn't show up, and so I had to rejockey everybody around, and that kind of added to the flavor of trying to get everybody positioned correctly. So thanks for your
Thank you.
patience on that.
I think you did a good job.
All right. Any other comments or thoughts before we say goodbye today? If
Thank you,
you're ready
everyone.
to-
Susan, everybody take care of yourself. Maybe keep in touch if you'd like. It was great meeting all of you.
Thanks and
So-
enjoy your retirement.
Thank you.